Hi guys, I'm Dr. Rahul this side, and today I will take the topic of COVID-19 and all recent updates. I will take the repeat topics, revision points, bullet points, doubt clearance, and everything. Right? So this is an important hot topic, as you know. In every exam, it is expected that almost you will get 4 to 5 questions from this topic itself. Right? In all exams. So uh, let's begin. Right? So first, I will start with the. I will take the points from different subjects, and I will try to collaborate all the points. Right. So starting with micro. So see, it is a. So I'm talking about COVID-19. Right. It is a novel coronavirus. We know this, also known as SARS-CoV-2. Correct. And incubation period is 2 to 14 days, right? So incubation period 2 to 14 days. Now see, who are the suspect case? Who are the suspect case? Those who have fever or any other respiratory illness, correct? Or those who have history of any travel in pandemic regions 14 days back, or patient with SARS that require hospitalization. They are the suspect cases, correct? And who are the probable case? So probable case, those whose test results are inconclusive. They are the probable case. Who are the confirmed case? Lab test positive, confirmed case, right? Irrespective of symptoms, if lab test is positive, it's a confirmed case. Okay. Now tests, you know, one is RT-PCR, one is rapid antigen test, right? Okay. So now I will talk about the genetics. See, it is an enveloped virus. You know, see, whenever a virus is enveloped, okay, and that's why we say that use sanitizer or hand wash, or use soaps, because the virus can be washed out, because it has an envelope, right? So it can be easily washed out with soap and water, right? That's the concept. So it is an enveloped virus. Don't forget it. It is an enveloped virus. Okay. Crown like with spikes, solar corona, right? It is a RNA virus, right? It is a helical symmetry. Okay. It is linear and positive single stranded RNA. Each and every word is important, guys. Okay. And it attaches to host cell ribosome for translation. Correct. Okay. Now the enzyme involved is RNA dependent RNA polymerase. This has been asked. Okay. Chalo. Investigation choice I already told, and it is a category B virus. Correct. Biosafety level, one is BSL2 and BSL3 lab. Correct. You know that. Now in BSL2 lab we will take the these specimens, etc. But for culture and vaccine we need BSL3. It's very important, guys. For culture and vaccine, BSL3. For testing and specimen handling, BSL2 is okay. The swabs, etc., they are taken at BSL2, and culture and vaccine preparation done at BSL3. Its pathogenesis, see, each and every point is important, don't miss it, right? ACE2 receptor, this is its pathogenesis, correct? This receptor is very important because the newly designed intranasal vaccines, correct, this will block this ACE2 receptor and thereby combat the viruses, correct? Okay. So okay, now what should I discuss? um, let me discuss the MLC part. Correct. This is short, so I will discuss it first. See, no autopsy done in a COVID-19 deaths. No autopsy to be done. There is no professional secrecy. Right? No professional secrecy. Correct. Then for legal autopsy, all right. For legal autopsy, consent from authority or relative required. Remember this. Okay. Now also remember, this is for doctors. Epidemic Disease Act. This is 188 IPC 3. Correct. According to it, detention and punishment. Okay. For 6 months. Actually, it is a legal, a protection for health workers. Those persons who will disturb the health workers at this, a pandemic period, they will be detained and punished for 6 months. The Epidemic Disease Act 188 IPC 3. Important point from the legal perspective. Also remember 2 IPC, as you know, 269 and 270 IPC, that anyone uh, negligent negligent act that will spread the disease. 269 IPC, and 270 is the intentional act to spread the disease. Intentional, or we can say malignant act, okay, or intentional act to spread the disease. 270 IPC. Under this IPC will be punished, right? Chalo. Next, treatment I will come a bit, at the last, right? So now I will go to the gynae part. That what is the disease significance in gynae and pediatrics, both I will cover together. Okay. So see, there is vertical transmission. Previously they told no evidence, but now there is evidence that there is vertical transmission via placenta. It's there. Correct. Important point. And receptor is same, H2 receptor. Okay. But genital fluids, through genital fluids, no transmission. All right. It is non-teratogenic. Very important. Non-teratogenic. This has been asked, guys. This is non-teratogenic. Important. Remember, it's non-teratogenic. Correct. Okay. Now, of course, if a mother is diagnosed positive, then of course you have to self-isolate for 14 days, and you have to continue fetal heart rate monitoring. Very important. Continue fetal heart rate monitoring, and chances are there that it increase preterm birth or increase stillbirth. These chances are there. Okay. And mode of delivery, NBD or CS, normal or CS, normal vaginal delivery or CS, right? If and regarding this one, vaccine doses, right? So gap between two vaccine doses, 4 weeks. Okay. If there is preterm birth, of course for preterm birth, we give steroids. So here we will give dexamethasone. Correct. Same only. And flu vaccine can be given. All right. CS is contraindicated where? If there is severe ARDS and obstetric complication. Okay. Okay. And early cord clamping not done. Early cord clamp not done. Also in PPH it is not done now. So it is already, it is not in practice. So same here. Neonate, yes, neonate has to be tested. Test neonate. Okay. And baby born should be infected. Baby born, right, has to be separated from infected mother if the mother is infected for 14 days. You can give bottled milk, in bottled milk means from mother, means whatever saying expressed milk, right? Mother will express her milk in a bottle and then you can feed the baby accordingly. Okay. Now you understood expressed milk, right? And breastfeeding is not transmissible. Correct. You can give the breastfeed without proximity as well. Okay, without proximity. All right, so obg point we discussed, and now I will discuss some points like yes, let's discuss the prevention part. Treatment we will take them in at last, right? So prevention is, of course, you know that you have to wash your hands regularly. It's enveloped virus. The virus will be easily washed away with soap and water. Okay, more than 20 seconds. Correct. This one is important. These are the points, which is highlighted in the exams, right? You can use alcohol based hand sanitizer as well, but alcohol based hand sanitizer. Correct. Now obviously the concentration should be more than 60%. 70% is better. Then I will talk about a complication of COVID which everyone is suffering, mucor microsis. See, first of all, you must remember that mucor is an aseptate ribbon like hyphae. Okay, like this. There is no septa. Okay, ribbon like. And also remember, in diabetes patients it is seen mostly. Okay, and it is angio invasive. Okay, angio invasive means it has the property of invading vessels, blood vessels also, right? And it has a property of necrosis as well, right? And yes, there will be blackish discoloration of orbit, palate, blackish discoloration of orbit, palate. Okay, then turbinates, because it has angioinvasive plus necrosis property, that's why. Correct. Risk factors I already mentioned: diabetes mellitus, HIV, elderly, immunocompromised. Okay, there will be double density sign on radiography. Okay, and it's emergency situation. Treatment is important, has been asked. Okay, treatment is IV liposomal amphotericin B plus debridement. I repeat, IV liposomal amphotericin B plus debridement is the treatment. Is important, right? Okay. Now, who are the high risk patients is also important: obese, uncontrolled diabetic patients, more than 60 years patients, right? Those who have serious disease, chronic renal disease, cardiovascular disease, carcinoma patients, liver disease, lung disease, pregnancy. Okay, particularly third trimester, because in third trimester the organ synthesis occurs in the fetus, right? So you know these points. Okay, so now I will discuss a bit about radiology. So radiology, one important segment is the staging, right? Staging. So I'm talking about the HRCT of lungs. So it is known as the Corhead scoring. Corheads, right? So I will first write the details of the scoring quickly, and then I will show you the images, right? So Corheads 1 is COVID-19, highly unlikely. Correlates to low susceptibility. Here whatever, here we can see in the image, in the HRCT, that there is small dilatation or bronchial valve thickening, tree in bud appearance, but remember there is no ground glass opacification. GGO means ground glass opacification. There is no ground glass opacification. 3 is indeterminate, right? Here there is unifocal ground glass opacification. Stage 4 is highly susceptible. This high susceptibility, right? So here there is consolidation plus GGO, ground glass opacification. Remember the important points. And fifth, it is obviously this is diagnostic, right? Multifocal ground glass opacification and consolidation. So in one it is highly unlikely, right? Two, low susceptibility, no ground glass opacification. In 3, 4, 5 you will see ground glass opacification, with 4 and 5 being high susceptible and 5 is confirmatory, and with consolidations, right? Now I will show you the images. Now see, this is your number 1. This is your number 1, correct? So you can see there is no ground glass opacifications. It is okay. In number 2, you can see there is this one signet ring appearance. There is dilatation, bronchial dilatation, but still there is no ground glass opacification, correct? This one is your number 1 second. This one is your number 3. Now here, see, here there is ground glass opacification. Can you see it? Little this one, see this one, this one, see this one. Now in stage 4, you can see very well this is ground glass opacification or pavement pattern, we can say, and this one is your stage 5. In stage 5, of course, there is consolidation plus ground glass opacification. Everything is there. See, consolidation, ground glass opacification, everything is there. So the image is important and highly, uh, high possibility of being asked in your exam, right? Okay. So now I will move to treatment, right? So treatment, mild, for mild disease, what will you do? This you know. For mild disease, we will give symptomatic, mainly symptomatic treatment. Means if there is cough, we will treat that. If there is fever, we'll give paracetamol, like symptomatic, and social distance, mask, and we monitor SpO2 temperature, right? And now I will tell about this one. Most common cause of mortality, it is most common cause of mortality is ARDS. Okay. So let's go in the treatment part. Okay. So I will tell about the recent protocols, but before I start with the protocol, I would like to say there is an important role of steroids. So wherever there is, in option there is steroids, do consider it is an important part of the treatment is steroids in any age. Right? Steroids is an important part of the treatment. So let's start with the treatment, right? So for I will start with the mild first. So mild, indoor mask use, SpO2 temperature monitoring. Now, okay, this is done. Now this has to be done, right? Number 1, talking about the core treatment, it comes ivermectin, right? 200 microgram per day, once a day for 3 days. So tablet ivermectin is an important in the mild, right? So, but in pregnant and lactating, it is contraindicated. Next is tablet hydroxychloroquine, 400 milligram BD for 1 days, right? Followed by 400 milligram OD for 4 days. Contraindicated is in allergy and GSPD deficiency, correct? Number 3 is inhalational budesonide. Inhalational corticosteroid, just to open the the bronchioles, right? To facilitate breathing. It is given with metered dose inhaler. Okay, 800 microgram BD for 5 days, correct? And we can add antibiotics, multivitamins, antitussives. We can isolate the patient, right? And when we'll ask him to contact back if there is difficult breathing and fever more than 5 days. Clear? Next we'll go what we'll do in case of moderate, right? In moderate means who will be categorized as moderate, whose respiratory rate is more than equals to 24 per minute, or SpO2 is 90 to 93% room air. He can breathlessness, he requires ward admission, right? So moderate requires ward admission. Okay. The oxygen support will be provided to him with rebreathing mask plus prone position. Prone position is important because prone position with has shown there is evidence that the breathing increases in prone position, correct? And treatment is mainly supportive plus steroids. Steroids is an important, steroid play an important role in that treatment part. So here you can give injection methyl prednisolone 0.5 to 1 milligram per kg, or dexa 0.1 milligram per kg. Plus we will give anticoagulants, correct? Anticoagulants, unfractionated heparin, low molecular weight heparin, correct? And we will show the patient work of breathing or hemodynamic stability, right? And few tests we can do, CRP, serum electrolyte, okay? then D-dimer, right? And every 2 to 3 days, because it is a moderate case scenario, so every 2 to 3 days LFT, RFT, CVC, right? And if the if the condition of the patient worsens, then we will go for radiology, HRCT, right, or interleukin 6. Okay. So now we are going to the severe. So who will be categorized in severe zone? Those who have respiratory rate more than equals to 30 per minute. Okay. And breathlessness, SpO2 less than 90% on room air, they need ICU admission. Correct. Now oxygen has to be provided, but non-invasive ventilation, FiO2 with oxygen helmet, or you can give high frequency nasal cannula. Okay. And intubation may be required, right, if they are not respondent to the above, the above techniques, right? And treatment is you continue your anticoagulant like unfractionated heparin and low molecular weight heparin. Just continue anticoagulants plus add steroids. Here also steroids play an important role. Same dose, injection methylprednisolone 1 to 2 milligram per kg IV or Dexa 5 to 10 days. And there is a chance of sepsis here. So if you take this, seriously, that there is a chance of sepsis, so you have to give antibiotics as well, right? And here the test should be daily test, right? CBT, CBC, RFT, LFT, CRP, T-dimer. If required, you can go for IL-6, interleukin 6, or HRCT. Now then I will say some drugs which are used for emergency approval or off-label drugs. These are off-label drugs. First one is remdesivir. So remdesivir is an off-label drug. So it is actually RNA polymerase blocker. Okay. So in moderate to severe cases we can give, right? And see, it has to be given within 10 days of disease onset. Okay, within 10 days. And for how many days you will give it? For 5 days. Okay. So this is the first drug. Second drug is tocilizumab, correct? So it is given in severe disease within 24 to 48 hour of admission, and dose is 400 milligram to 400 milligram for 60 kg, correct? And third is convalescent plasma convalescent plasma for moderate disease, right? But here cutoff has to be maintained. The antibody titer cutoff should be more than equals to 3.5. So this is in short about the treatment, right? It was this was according to the AIMS guidelines almost at July, as I saw, correct? And few recent things I have taken. And regarding vaccines, there are two main vaccines: Covishield, Covaxin, right? As correct? And an intranasal vaccine is supposed to be approved, in the coming year. So as I told, ACE2 receptor blocker is the main mechanism of action as it is supposed, right? So with this, I think I have covered all the topics here. And yeah, so I have covered almost all the topics which is relevant for your exam. So hope this session will be helpful, right? Okay, so take care and see you in my next session, correct?